Ready.
All right, you're ready.
We named the embryo Frosty.
Renée Higgins is desperate to have a baby.
Here's my hands. Can I put the speculum in?
Yes.
And right now, that dream hangs on this moment.
The embryo.
The only embryo Renée has left from 6 rounds of IVF is being transferred to her body. Renée's hopeful, but after 2 miscarriages from previous transfers, she knows there's no guarantees, no matter how much she's gone through to get here.
Hi, Renée.
Hi.
Hi, I'm Ellen.
We first met Renée weeks before at 3:30 in the morning.
Oh my God, it's ridiculously cold.
Navigating to Markham Fertility Center.
4 hours and 20 minutes.
Yeah.
Renée lives in Sudbury, Northern Ontario. The closest fertility clinic where she can do IVF is all the way in the Toronto area. This is the reality for so many Canadians. Geography making the already complicated process of IVF even more challenging. And Renée has had enough.
How much harder does all of this travel and all of these logistics make the process?
Significantly harder. It's draining. Mentally, emotionally, financially. I mean, we're over $100,000 out of pocket for treatment and medication. And then on top of that, the travel costs. So yeah, we remortgaged our home to do it.
Wow. Wow, that must have been very hard.
And having the drives to worry about on top of that are just crazy.
Renée is 35 and has fewer eggs than most women her age.
I really thought we're going to be the ones, the first IVF cycle, it's going to work, and it didn't.
It's hard to accept.
It's really hard to accept.
Battling infertility in 2023 was intense. So many ultrasounds, blood draws, and 3 a.m. drives to the clinic.
Fertility treatments can be harrowing, even traumatic. Countless appointments, countless injections.
Needles in hotels, needles in cars, needles everywhere. I had such a good feeling this time, but it didn't work.
But no matter how much heartbreak Renée and her partner have been through, it was the travel that made her decide to stop.
Financially, we could have done another IVF cycle, but I just couldn't do the drives for the 7th one.
And as we drive with her, it's little wonder why.
These are tough conditions, like blowing snow.
Like, this is nowhere near the worst of it.
We're heading to Renée's clinic to start the process for her embryo transfer, the last step of IVF. She'll have to do this drive several times before it's done.
How does that feel that it's the logistics of the situation that have prevented you from trying again?
I feel very frustrated. I feel like we can do better.
IVF, or in vitro fertilization, is the process of taking a woman's eggs and fertilizing them outside of her body. The average cost for one cycle in Canada is $20,000. Most will need multiple rounds to get pregnant. Fertility clinics offering IVF are concentrated in urban centers, and access varies widely across the country. Some provinces only have one clinic, while several others and the territories have none. And when it comes to financial support, 7 provinces have a tax credit or funding program. BC will join that list next year. Quebec offers the most coverage, funding 1 full IVF cycle, including the drugs required. Alberta is one of the provinces where there's no public funding for IVF treatments.
Based on how the cells are divided.
In Calgary, we meet this group of women trying to change that.
Infertility isn't necessarily looked at as a medical diagnosis. It's looked at as, you guys just drew the short straw.
It's incredible how many of my friends and how many of my family members go through the same thing and nobody knows about it.
Fertility Alberta is one of several grassroots advocacy groups pushing for more support across the country.
I just started asking a million questions and why can't we do this?
Like Renée, Ashley Eberly and her husband are out more than $100,000, still trying to achieve their dreams of parenthood.
Obviously, you can see the emotional toll that it takes, and you know, it's been tough. I thought I had a lot of time, and
Michelle Chidley co-founded the organization. She needed IVF to conceive her sons.
When we go into our meetings with government, we present what the other provinces have done. There's no perfect solution, but we're working with them to try to find what's in the realm of possibility in this province.
Why do you do this work?
When I went through my own fertility journey, I felt incredibly alone and isolated. We live in a country with universal healthcare. 1 in 6 Canadians have medically diagnosed condition that makes it difficult to have a family on their own. It doesn't seem right that people need to pay out of pocket to overcome their medical challenges, especially in a country like Canada.
I tried my hardest, did everything I could, but the cycle was canceled.
As tough as Renee's journey has been, she had some help. Ontario offers residents one funded cycle of IVF, but that doesn't cover the drugs needed. The waitlist can be long, which doctors say jeopardizes treatment options, and the province's medical travel grant doesn't include IVF.
There's some people I've talked to who have 15-hour drives to the nearest place they can get an IVF egg retrieval at. It's crazy.
Where do you get the strength to keep going?
In the beginning, it was hope. But when I lost that, I found that passion for advocacy. I started sharing my story more, trying to help people online.
I'm on daily intramuscular progesterone and oil injections and daily subcutaneous Neupogen injections.
Renée works with nonprofit Conceivable Dreams, pushing Ontario to do more, like making it easier to do some of the required appointments in local communities and creating a tax credit to help cover all the additional costs.
Not only would it provide the benefit of assisting with the medication, testing, and travel costs, but it would also provide an inclusive solution that covers all of the reasons that someone may require fertility treatment.
Nova Scotia recently launched a tax credit offering up to $8,000 a year. Carolyn Dubé leads advocacy group Fertility Matters Canada.
Hi, Minister Thompson. So nice to meet you.
In Halifax, meeting Nova Scotia Health Minister Michelle Thompson.
So I think we've had about 200 applicants to the tax credit program so far.
Amazing.
Yep. So we're encouraged by that.
With the patchwork of provincial measures, Carolyn's organization is pushing for a federal strategy to make it easier for more Canadians to grow their families like she did.
You know, we've got an incredibly low fertility rate, and research shows that a low fertility rate impacts the economic output or health of a jurisdiction. So what's going to happen in 30 years? Who's paying into pensions in 30 years if we're not helping to address this issue now?
Back with Renée, the sun has finally come up.
So as you get closer to getting to the clinic, like what's going through your head?
I'm always worried that they're going to find something that's going to stop the cycle, which is just devastating in general, but also means I've done this whole drive for nothing.
Okay.
Have arrived.
4.5 hours later.
Yay.
Renée hasn't been here for about a year.
The cold is waking me up though.
She needed a break between the end of her last IVF cycle and transferring the embryo, seeing it as her last chance.
It feels really weird being back in the building, and it's kind of just, we're doing this again and everything that means. Hi.
After blood work, it's time for an ultrasound.
Hopefully the last time.
And finally, a good surprise. Renée's ovaries have more follicles than she expected.
Does that say I have 10 antral follicles?
More follicles means more potential eggs and maybe more embryos.
It does say 5.
Oh my God, wow. Okay, that's awesome. I was nervous I'd have like 10 antral follicles, oh my God.
It's a number that may change Renée's mind about not doing that 7th round of IVF.
Our best ever IVF months were the 2 months that we had 10 antral follicles, and that's what I have right now. So
that's exciting.
Yeah, we'll see where things go.
Renée will be back here in just a few days. Her long drive home now made easier for once by the positive news.
These are all the cards that have been given to me by patients.
Wow.
Over the years. They are so special.
We go back to the clinic to meet Dr. Mavis Garcia, Renée's physician at Markham Fertility Center.
I've never discarded a single card I've gotten in the last 10 years.
This one says, "You rock, Dr. Garcia."
Dr. Garcia has helped countless patients build their families.
These people wouldn't have these beautiful children if it wasn't for fertility treatments, right?
Have you had would-be patients who really want to come here but just can't? They can't travel that far. They can't afford the hotel stays.
Yes, I have spoken to patients from all over Ontario, from Owen Sound, from Timmins, from Thunder Bay. And the situations are very similar.
What is the impact of women not being able to access fertility treatment?
Well, very simply, the impact is that they might never become parents. And that's not fair. Any of my patients could tell you, as I could tell you, having gone through infertility myself, it's not something that you do because you want to. It is something that you do because something isn't working in your body, but it can also impact people that are needing fertility services for reasons unrelated to infertility per se. Cancer treatments, genetic conditions, members of the 2S LGBTQIA+ community. So it really impacts quite a lot of people.
You know, there may be a lot of people who hear this story and have a lot of empathy, but would say the healthcare system has a lot of issues, more pressing ones. Why should this be a focus of provincial governments? What would you say to that?
I would say come to my office. Come to my office and sit with me in that chair and look into the eyes of somebody that wants to be a parent and they can't. And then you can come and tell me it's not important.
Renée did that 7th round of IVF, a miracle, she says, resulting in 5 embryos, more than all her previous cycles combined. But with the new embryos still being genetically tested, the one being transferred now is the only one Renée knows she has for sure.
Okay, that is done. Everything went really well. I mean, it was a really, really good transfer. Perfect. All right, so here's the dish.
And after it's over, a special gift for Renée.
So that's where the embryo was living up until this moment.
Thank you so much.
You are so welcome. All right. Thank you. All the best.
Weeks later, a special announcement.
There's a second line. It's really faint.
After all those long drives and money spent,
This one too.
Renée's dream may finally be coming true.